the learnings and utilizing the lessons learned from COVID-19 pandemic experiences in digital health and telemedicine for NCDs. And one of the challenges was having different applications that people have to move from an application to an application. So the way forward is to merge those examples or the applications that I have just mentioned and integrating it in different services in one application, which is a Sahati application. And finally, 3 days ago, NCD patient, they had the priority to get COVID-19 vaccine, and they had the opportunity to register in Sahati application. Thank you very much.
Thank you very much, Dr. Shakir, for sharing the experience of Saudi Arabia. Now, last but not least, of course, we will be listening to Dr. Buthaina bin Leila from UAE, from the United Arab Emirates. She will share the experience of UAE in the implementations of digital health and telemedicine. Dr. Buthaina, the floor is yours. Go ahead.
Good evening. Thank you, Jalal, for the introduction. And I would like to thank WHO EMRO region for this kind invitation. Today we'll talk about we'll talk about the experience of digital health in United Arab Emirates. Next slide, please. If we look at the burden of non-communicable disease in United Arab Emirates, it accounts for 77% of all deaths. And if we look at the risk factor, we can see overweight, obesity, and physical inactivity are among the highest risk factor. Also the blood pressure and the raised total cholesterol. Pre-COVID-19, NCD services were integrated in all primary healthcare centers through specialized clinics with well-trained multidisciplinary team, providing comprehensive services, including risk assessment and periodic screening programs, managing all non-communicable disease, including pre-diabetes patient also and common mental health problems, according to UAE updated national guidelines. And also we involve the patient and family-centered health education through training and empowerment programs. Next, please. During COVID-19, NCD management became a challenge because NCD patients, as we know, they are considered at high risk of infection and morbidity. Patients and families were worried to attend their appointment, and we expected increased risk of exacerbation and complication. So we set priorities that our NCD patients should have a priority in providing the essential care during COVID-19 break. And also we have to provide the best and safest medical care of for national and expatriate in the UAE. And we have started transforming our NCD services towards digital health. So we approached all our NCD patients before they ask. Next, please. And we were inspired by our government when His Highness Sheikh Mohammed bin Zayed Al Nahyan Conference of Abu Dhabi, he announced, "Let's Shilun him," which means don't worry. And he said that food and medicine are red lines and people living in UAE, citizen and expatriate, will be secured regarding their food and medicine. So community reassurance was a must and priority. Next, please. So we started by increasing the community health awareness by providing awareness program and messages through all social media channels regarding how to stay distance, hand hygiene, and also for non-communicable disease, how to stay healthy and safe. And also we set a lot of virtual meeting for public on precaution and how to deal with non-communicable disease and mental health, with introducing a lot of experts from the field and focusing mainly on mental health and cardiovascular disease, because most of the patient was delays in seeking attention. Next, please. Regarding the digital health, in 2017, the government announced an initiative called Doctor for Every Citizen. But because the population didn't accept it and it wasn't activated due to some social and cultural perception. So it was delayed, but during the crisis, it was re-announced again. So in the beginning of the crisis, we have allocated clean clinics in every district with the NCD team, nurse and physician who are not dealing with COVID cases and who has regular PCR testing. We set a trial system at the entrance and protective measures to provide emergency care and urgent consultation for high priority cases. And it all was through appointment system by date, time, and phone call reminder, and management was provided accordingly. During the crisis, all NCD patients were contacted earlier, and their medication supply of 3 months was delivered safely to their home, and sometimes can be collected by their relatives from the pharmacy directly. Next, please. In March 2020, digital health was announced, and it was a great demand on the digital health. NCD patient can access the digital health by free consultation and follow-up through voice and video calls 24/7 through a certified physician, and access can be also through smart application. The physician can request laboratory and radiology tests and issue electronic prescription that covers all UAE citizen and resident. Medication home delivery services were provided among all UAE for NCD patients for 3 months, even if they have or any patient have any acute problem. Also, the medication were provided at home. Drive-through blood collection also was initiated in some clinic according to the infrastructure, and also we established a hotline for mental health consultation for the patient and also for the healthcare provider. Next, please. The impact of digital health, we can see that the e-visit and virtual visit workflow was implemented through our electronic system, and it was highly accessed. And the number of NCD patients covered was more than 100,000. Number of healthcare providers trained more than 600 through the virtual smart learning application platform called Maharati, which provided more than 20 workshops per month. Also, we have a virtual multidisciplinary team that provides a needed consultation for NCD patient with immediate patient satisfaction feedback. Also, pre-diabetes patients were involved in the multidisciplinary team, and we have seen that the follow-up has increased compared with the last year. And also, we have implemented Sukkari application for pre-diabetes patients, where more than 34% of patients were enrolled. Next, please. The main difficulties that most of our NCD patients to allocate them was difficult because they are seeking different healthcare through the government and the private sector. Also, we have some remote clinics that lack electronic services, and we have a very big geographical area for the medication delivery. And we will have some issue with training all the healthcare provider, the lack of guideline and framework for the digital health, and the lack of social acceptance among elderly especially. We overcome this by announcing the digital health, the initiative called A Doctor for Every Citizen in UAE, and it was through the whole social media and the website. A remote area, we concentrate on the e-visit through the phone calls. We have increased the awareness and services marketing. We have allocated, as we mentioned, clean clinics. The healthcare worker capacity building was increased through the e-learning and webinars. Patient satisfaction survey was encountered at end of consultation, and it helped us in modifying our services. Secondary care consultation was arranged virtually, and even consultation abroad was started virtually. Next, please. In the next phase, we are planning to launch a policy and a guideline for digital health, that virtual consultation to be available all the time, 24/7, all over UAE. to expand our collaboration with the broad doctors and hospital for teleconsultation and virtual consultation. Also, we have Shifa platform innovation that is a patient electronic portal where the patient can access his report, her medical investigation, and also he can modify his appointment and he can choose the doctor consultation. We have expanded our virtual consultation through the shopping malls. It was launched in Dubai in August with around 7 languages, and we are planning to expand it. We have improved our multidisciplinary team virtual consultation system, and we are looking for simple access digital health application for our elderly patient. Next, please. And thank you for all you all. And our logo in UAE now is commit to win, and we are planning to commit all to win and succeed in this crisis. Thank you all for listening.
Very inspiring logo. Thank you very much, Dr. Busaina. And with Dr. Busaina, we come to the end of the second part of our webinar. Thank you all, our speakers, sharing the experiences from Ministries of Health and from country offices. Please do not forget to visit the webpage we have previously shared with you, and I will share it again now in the chat to visit to have more information about the case studies. And now I will give the floor back to Dr. Hiba. Thank you, everyone.
Thank you very much, Iglal, and thank you very much for the presenters. Actually, very rich experience that we would like to document in maybe a publication that can be posted on the website of WHO, and definitely we'll be working with you and other countries in the region to document more case studies, especially in this area that actually is expanding and is evolving every day in a dynamic way. Now we can move to the end of this webinar and the last session, and we have with us Dr. Slim Slama, that the regional NCD advisor in WHO EMRO office, and I would like to invite him to tell us and talk about the way forward for the digital health and telemedicine as seen by the NCD specialist, and how can we overcome the gaps and challenges and what actually is needed in order to implement properly some sort of strategic or essential strategic intervention in that area. So over to you, Dr. Slim, and the floor is yours.
Thank you very much, Hiba and Iglal and the team. It was amazing. I just jumped out of the plane. I was on my home leave, but it was really worth, for what I listened so far. And I'm very humble when I heard all this richness of experiences and expertise, in this virtual room today. There's plenty of things to learn, and I learned a lot. So it will be a pleasure for me to be able to summarize all, but I think I took some notes and some elements that I would like to blend between an NCD perspective and maybe a digital health one. I think all of you have witnessed that harnessing the power of digital technologies in maintaining essential services in terms of preparedness and response for all type of emergency, as Dr. Shekhar alluded to, is critical and can be. I think it goes for the emergency. I think we have Dr. Zahra, member of the family, are saying hello to me. Can you mute the microphone? Thank you. As I mentioned, yes, there is for sure, several illustrations that harnessing the power of digital technologies for emergency preparedness and response in the situation of the outbreak, maintaining essential services, but beyond that, also developing these national strategies for digital health will respond to the health need and to achieve also SDGs. There is also, for me, I think from what I heard, an important equity perspective. We have seen, different countries and our region are diverse. I think like it was outlined in the digital global strategy, there is a need to probably address the determinant of digital health in terms of capacity, in terms of infrastructure, in terms of regulatory framework, in terms of ICT literacy, access to equipment, connectivity, as we have seen. I mean, some of the countries are not at the same page in terms of their ability to really harness these tools. And I would perhaps outline 5 elements that I learned also, and somehow some of the guidance that also WHO have tried to put forward to support country. I think the first one, if we compare like the 3 or 4 countries from the GCC, and I had the chance, I mean, to look back also at their strategies, that digital health was not isolated. Digital health was part of a digital transformation that has been accelerated by COVID somehow. But in the situation of the GCC in particular, I think it was a way to diversify the economy, to increase accountability to our citizens with e-governance across sectors. And this has also led to significant investment, as we have seen, in terms of infrastructure, human capital, regulatory environment, incentive for the private sector. And all those elements have some of the ingredients that explain also that some of the GCC example in particular are somehow a bit more diverse in expanding all type of solutions and digital solution, and have been probably much more mature than some others. But I think this is where there is these equity challenges. And I think what I learned from that, the first is that we need to understand the health needs, because as Hiba has mentioned in the framework, in these guidelines that she was alluded to, the first element I think is the health content. What are the health problem needs? Like Dr. Raisi from Oman has mentioned, those assessments to understand really how their disruption have affected the lives of people with chronic condition. Because for someone living with a chronic condition, continuity of care is critical, and continuity of care have several dimensions. Continuity in terms of information and being able to link episodes of care between them, and continuity in terms of relationship with the provider, with the nurse, with someone that was supportive. Continuity in terms of coordination across level of care and referrals. Also continuity of care, of course, for essential drugs, provision, diagnostics, tests. And all those elements relate to what are the needs. Of course, there are different digital health solutions for providers, as we have seen in terms of training, for supply management chains as well. But if we first understand what is the health program needs and the content of what we want to put into the digital health solution, I think this is the first starting point. The second one is what I was alluding to, is to identify the pre-existing challenges. In many of our countries, NCD and mental health are not part of the benefit package. To expand universal health coverage, many countries still think that it's a sequential approach. We address the old agenda before addressing the NCD. But across our region, at least a third of the mortality are related to NCD. So having within the discussion of the benefit package an element of NCD integration, including for digital health solution, I think should be an integrated part in the development of strategies and plan for health in general, for emergency preparedness and response, for digital health. All these actually need to be progressively prioritized. The other element are the health system challenges that we have heard several of them, like the inability to really identify the role and responsibilities of teams. Many of the country that you have seen specifically from the GCC were referring to multidisciplinary teams, but sometimes we don't have that luxury to have multiple providers providing NCD care in particular. So the ability to identify what could be the role and responsibility, including through digital health solutions for different team or dealing with someone with chronic conditions. The health information system in particular has really one of the most important weaknesses that have been revealed by the COVID pandemic. Like in many countries, the inability even to contact people that were irregularly seen at a primary care level because the database, because the registry were deficient. And as Dr. Buthaina have alluded to in her presentation, NCD care and chronic disease care is proactive. It's not something that we need to wait or the patient to call you, but to be able actually to proactively early detect, manage, support, prevent those conditions before they happen. And we have seen how much of those health system challenges have been revealed. And I just name, these two, the role and responsibility of providers, the health information system, the unavailability of essential drugs and technologies, the cost of them has been really highlighted during this pandemic. The third element, perhaps, that I learned from those presentations is that we need to match the health needs with the appropriate digital health intervention. In other words, how we match progressively what we want in terms of content, whether promotion for prevention or for healthcare, and then we adapt it to the digital health intervention in terms of functional requirement, but also to manage perhaps the expectation of the end users. We have seen in some of the countries, despite availability of digital health solution, the uptake was not that high. So we need actually to understand from the provider side, from the end user side, what are the expectations. And then, of course, look at the existing platform that exists in terms of infrastructure. Many of you also pointed out to the legislation changes, the regulatory environment, and how data is managed, because digital health is about information, it's about communication, and data require privacy, require security, and require regulation. And many of our countries haven't yet a very strong framework for those elements. The fourth element is a budget. And I think Dr. Iman from Sudan mentioned also, very few donors have entered this field and have also supported. And the sustainability of financing, many of the projects that we have seen across the region were really projects, were pilots, were some expansion, were reactive to some of the funding, whether emergency or from development fund, but very few have embedded really, with the exception perhaps of some of the GCC countries that we have seen here, have really invested 4 years in this field. So this is also something where the financing application should be thought through as part of the planning. The last aspect perhaps for me is monitoring and evaluation of various type of digital health solution. As Hiba mentioned, I think this classification, there was a bit of a mixed bag about how we describe this, sometimes showing that everything seems to be really marvelous. Well, actually, we need a granular analysis and an evaluation and a documented impact of the service availability, of its use, and also on the performance. And I think this is where operational research in particular, and there is a guide of WHO, digital health and research, I think it's important also to look at is how we progressively evaluate what we do. And I think what you have done today was extraordinary in the sense that this knowledge sharing is really important, and this is what WHO should further support. Our colleague, I think, Ahmed Mendil and Samir from HQ are doing that, is creating this network, a knowledge network, to be able actually to really document what is happening out there. From an NCD perspective, and I will end with this, I think my take-home message is that given the importance of continuity of care for NCD, NCD could be really a trace conditions to test the robustness of digital health technologies across a range, and we have seen it from promotive, preventative, for early detection, for the management, at all aspects. I think it could be that we better document also the use of digital health for NCD. We could have a series, and what you are doing actually is somehow already documenting a lot of elements. I think there are some areas that would require a bit more digging, as some of you have mentioned. The use for self-management in particular, given the fact that self-management is not that developed in our region. The role and responsibility of a multidisciplinary team and the use of digital health to support that. Databases and electronic health system, and how can we enhance this, because this is a critical element for continuity of care. And maybe the use of public-private partnership with all, perhaps the confidentiality, security, and regulatory framework that need to go with that. And I will close there. I think it was, for me, eye-opening session. A lot to do out of that, but I think it's a very good step in the direction. Thank you very much for listening and to staying with us until very late today.
Thank you very much, Slim. And actually, you concluded with very important messages. And yes, this is an eye-opening for a very big portfolio that needs further discussion, further work towards achieving a system that really we can say that meets all the needs and can really respond to these health system challenges and reach the ultimate goal to cover health for all by whole and provide universal health coverage as needed by SDG. Now, I think we are staying over the time by more than 30 minutes. And if there is a hot question that needs to be asked to the panelists, I would actually invite 2 or 3 questions maximum so that we cannot exceed more than the next 10 minutes. So I see that we have Dr. Fatma, we have
Shurbaji speaking here.
Najib, Shurbaji with us, and we have actually many participants from different countries. So please raise your hand for the intervention. We will be providing 10 minutes for your intervention. Please raise your hand.
Well, I have raised my hand, but I just want to provide a comment, not really a question. And my comment is basically, how can the different countries in the region learn from each other in both NCDs and digital health? The experience that has been presented by Qatar, by Saudi Arabia, by Jordan, by so many nice, fantastic presentations that we have, I think it's really important to leverage this learning and to make sure that countries don't repeat the mistakes. They make use of the success, and they do actually implement what has been successful in one country. I don't want to say that there are similar problems and similar health issues and challenges in all countries, but all countries are facing non-communicable diseases. All countries are facing this pandemic. Not necessarily all countries are actually at the same level of development when it comes to digital health. And that's where it's really important for them to learn from each other. And what is better than having the regional office in Cairo being a platform for them. So I would like just to urge the countries to work with the regional office, to work together so that they can develop, not necessarily at the political level, because we know that there are so many crises and so many struggles and so many conflicts, but at least at the technical level, so that they can work together and they can deliver as one for the benefit of the people that they are supposed to serve. Back to you.
Thank you very much, Dr. Najib. And actually, this is a very valid comment. And maybe Dr. Mandil has some insights about the role of WHO, especially the regional office in this regard, especially with the COVID-19 crisis. Over to you, Dr. Mandil, if you are still with us.
Yes, thank you so much, Dr. Heba. It's a pleasure actually to listen to the national experiences in support of digital health for NCDs during the COVID pandemic. And it is amazing how much work has been done in 1 year in comparison to tens of years before. Al-Haja al-Ikhtira' for sure. And I've been quite impressed by the young people who have presented today the experiences of digital health and innovation in their member states. And I think we are more than happy in the digital health team in EMRO to work with all of you, whether as NCD directors or digital health innovators, in learning from each other, sharing expertise, refining the innovations, and making sure that the right innovation reaches the right place. And indeed, as I mentioned in my presentation, if half the world population
doesn't have access to internet. Almost everybody has one or more smartphone, which could be used in telemedicine, telehealth, digital health innovations in our member states. We at the regional office are at your service. Mr. Mohammed Noor and I would love to work with all of you. We appreciate what you presented today and keep up the good work and stay safe. Thank you.
Thank you very much, Dr. Mandil, and for the comment for Engineer Mohammed Noor, please.
Many thanks. Actually, I like very much all the presentations, and I feel that we have lots of work to do together. And actually, I put it on the chat first, and then I found that it's better to say it. I was saying that if you can collect all these initiatives and assess how they succeeded in providing the service in a good matter and in a good impact on the NCD, I think it would be a very good opportunity for us to facilitate the demand that is happening in other countries to use the same expertise that we have in countries that have been implementing already. So I saw lots of in Saudi Arabia, lots in Qatar, and Oman, United Arab Emirates. I see all these initiatives that is working and that is in service and is providing all the needs. So maybe some countries in other areas are just starting, and we need to match the demand with the innovation that already exists. So thank you very much for the excellent session, and we learned a lot, and we see that we have lots of work to be engaged with you and with the country implementations. Thank you very much.
Thank you very much, Engineer Mohammed, and actually it's our pleasure to work in collaboration with the e-health and the digital health innovation department and unit in IMBO. And I think we can come to the end of our session today. Thank you very much for staying late and for everyone and for your engagement. Thank you for all speakers. We would like to take your permission by a message that will be sent to all speakers to allow us use your presentation in a PDF format to continue working on the case studies and our publishing of those studies on the WHO website. So more countries to come, more experiences to be discussed and shared, and to learn from each other. Thank you very much, and looking forward to the next webinar, hopefully that can be planned together next year. Thank you, and have a nice evening and a night for everyone. Thank you.